So Black feminism is very broad in a sense, and it encompasses many things. But I also lean into other critical theories that also come from indigenous ways of knowing and doing this work. But essentially, these approaches help me think through how this work contributes in its own way toward anti-colonial health futures, which is basically we envision and reimagine and we work towards building systems of healthcare that are actively resisting and dismantling these legacies of colonial violence that is shared across not just indigenous people, but Black people and brown people, and how it kind of harms everybody in a sense. So not only thinking about Black feminism as this way of doing the research, but how does it kind of complement what other people have been kind of doing in a sense to work toward this same vision.
Hey friends, welcome to Public Health Careers. I'm Omari Richards, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Bryce Takenaka, MPH, CPH. Bryce is a PhD student in public health, social and behavioral sciences at the Yale School of Public Health. He is also a research fellow through the Yale AIDS Prevention Training Program at the Center for Interdisciplinary Research on AIDS. You can also find him on Instagram at the Epic Epidemiologist, link below. He conferred a Bachelor's in Public Health from Lindenwood University. He then got his Master's of Public Health in Epidemiology at St. Louis University, and he's a current PhD student in Public Health, Social and Behavioral Sciences at Yale University, while also doing a Master of Arts in History of Science and Medicine. In today's episode, you'll hear and learn more about his journey to becoming a PhD student in social and behavioral science and the challenges that come with that, how his multicultural background shaped his perspective on public health and health, the importance of authentic community engagement for successful public health work, how Black feminism and anti-colonial scholarship offers a valuable framework to tackle systemic structures, advance health equity, and improve health, how research and mentorship are pivotal in shaping public health perspectives, how social media can be beneficial to public health students and provides an opportunity for collective liberation, and much, much more. Be sure to hit that subscribe button, leave a review, and enjoy today's episode.
Hey, this is Bryce Takenaka. I'm a PhD student at the Yale School of Public Health, and you are listening to Public Health Careers.
Bryce, I'm so excited to get some time to sit down and chat with you. Welcome to the show.
Yeah, thanks for having me. Glad to be here.
Yeah, so it's always nice to connect with Instagram friends in the public health space. So I'm definitely excited to dig more into your journey and how you got into public health and all that good stuff. But to start things off, how do you identify and tell us a little about your personal background?
Yeah, thank you. So my name is Bryce Takenaka. I use he, him pronouns. I'm from Ewa Beach, Hawaii, on the island of Oahu, but I'm currently based in New Haven, Connecticut, doing the PhD program in public health. I'm a second generation immigrant where my mom and her family's from the Philippines, and my dad is of Japanese descent, but most of his family grew up in West Maui, Komohana, and Honolulu, so on the island of Oahu, sorry. And I guess outside of being a student and a researcher, I still enjoy reading and writing in my free time, spending too much time and money in bookstores. I've been trying to get back into photography, but when I'm home, I like to do hiking, paddleboarding, all of the water activities, and just spending time with friends and family.
Love that, and I think it's so important to have those hobbies and do the things that I think keep us alive. I guess to kick us off, do you have any books that you're reading right now that you'd recommend?
Ooh, what am I not reading? I wouldn't say this is a fun read, but it's a book that I've been reading for class, but it's called The Black Shoals. It's by Tiffany Lethabo King right here.
Okay.
And I've been trying to read some of June Jordan, so I'm going through her book, Some of Us Did Not Die, so that's been pretty cool. So those are just some of the things that I've been reading so far.
Well, I appreciate those shout outs. I'll definitely add it to the show notes and to my ever-growing book list. To your point, like I like reading too, but there's just so many books out there and just don't have enough time, to
Hmm.
be honest. So what was it before we like jump more into your story? I'd love to know what was it like for you being Filipino Japanese growing up in Hawaii, and maybe how does that relate to some of your public health experience?
Oh my gosh, yeah. I I think I don't think I really had a lot of reflections like in the moment of growing up. Like I don't think I had the language to describe what it meant to be from somewhere, but not at the same time because I'm not like Native Hawaiian. I'm not indigenous to the land, but um, I was born on the soil and was raised there, so it was just sort of like something that I guess like I've always noticed, but it never really like I never had to really come to terms with it or really think about it growing up. But I think it was really interesting in respects to coming to the continental US because I grew up around like a lot of people that looked like me and had families like me, and not to feed into the whole this like multiculturalism thing because I have thoughts on that, but I do think like it really surprised me kind of coming up to here and that not being the case. And we can always talk more. We can talk more about like what that means regarding like how we think about different categorizations as like public health folks do for the research and the programming work. But yeah, I think overall, I think it was very. It was just like a beautiful childhood, kind of growing up and like being around really good people, really being grounded in a lot of like the more of like the indigenous ways of like being connected to the land, connected to the people, connected to everything. And I think that sort of like concept of like relational thinking really informs how I show up in my work and how I continue to try to move through the world and other like academic spaces and all that stuff.
Yeah, that makes a lot of sense, and I can imagine that reflection for you coming from going from Hawaii to continental USA, or when I was in Alaska, they call it the lower 48, um, and just the contrast and like people and that realization. Because for myself, I'm from Trinidad and Tobago, um, mostly Black population. We also have a very strong like East Indian population as well. I would
Mm-hmm.
say they're split maybe like 40%. Um, and I went to school in the Middle East, so very few Black people in my school as well, and most of the Black people in my school were from Africa, which is different for me as well, being from the Caribbean, and then coming to the U.S. and going to a predominantly white school. It really was. It really did take some adjusting too. So I definitely understand that. And I guess on the as you're saying, like that experience kind of shaped your relational thinking, which I think is interesting because as a PhD student at the Yale School of Public Health, you're conducting spatial epidemiologic research with the focus on HIV and preventative services. So how does that intersection of spatial analysis and public health contribute to better outcomes for marginalized populations?
Yeah, yeah, I appreciate this question. And I think it's something that I'm also continuing to mature how I'm thinking about it. But I think I have arrived to this because location and place has always been kind of like this common denominator when we're having conversations in public health from countries related to, the pandemic, but also like at like a neighborhood level and how that's kind of like been growing in regards to how we scale geography in public health, um, and also kind of like in combination with my own like experiences in healthcare, but also like how I'm being trained as a student in public health from the undergraduate level to like the graduate level, to like how I have to occupy this position as like an HIV researcher at different institutions. These encounters provided me the language to ask questions related to how the experiences of HIV, and that is said widely, isn't sort of like this one size fit all, nor is it distributed, nor the political and social arrangements that create these things are equally and equitably distributed. So I think HIV invited me to think about things on a more environmental level and in a more complex way too, and then how that kind of has all tied into like the same marginalizations that Black and brown, queer and trans folks have been kind of experiencing through just like one pathway of like disease, which is HIV. But that's sort of like where I've arrived at that.
Yeah, well, I appreciate that, and I definitely think it is always interesting to like understand the intersections of things and how they show up differently in different places.
Mm-hmm.
Um, and a lot of the work that you have done involves using the Black feminism as a guide for mixed methods approaches. When I was doing research on you, this was the first time I kind of heard about this like methodology thinking of things. So how does that theoretical framework inform your research and guide your efforts?
Yeah, I appreciate that. And so Black feminism is very broad in a sense, and it encompasses many things. But I also lean into other critical theories that also come from indigenous like ways of knowing and doing this work. But essentially, these approaches help me think through how this work contributes in its own way toward anti-colonial health futures, which is basically like we envision and we imagine and we work towards building systems of healthcare that are actively resisting and dismantling these legacies of colonial violence, violence that is shared across not just indigenous people but Black people and brown people, and how it kind of harms everybody in a sense. So not only thinking about Black feminism as like this way of doing the research, but how does it kind of complement what other people have been kind of doing in a sense to work toward this same vision. I think just being in HIV has organically led me there, because HIV is like, I know it's like a big crisis right now, but I think like I never realized how politicized it is. And, you know, when we think through all of those system things, like we need to also, it requires addressing these issues through a systems lens. And I'll just say like Black feminism has also helped me not just the understanding of like HIV and its web of determinants, but I think it also it has made me, I guess, a more thoughtful researcher, and it challenges me to quite question and be constantly in struggle with myself of whose voices am I centering when I'm doing this work? What type of knowledge systems am I drawing on when I'm thinking about these things? What methods are being considered and what aren't? And those sorts of things that often do not make it in like traditional research training processes. And yeah. So that's sort of like how like I've been kind of trying to steward Black feminism in this like HIV research landscape.
I appreciate that, and I think it's important to do that, because I like in public health, or like broadly when we think about positive systems change, we many times, or like the idea that I have for it is we are in the conditions that we are right now because the people have made the decisions to create the system the way it is, and the people that have been most marginalized and most oppressed by the system have not been given a chance to have their voice heard or have their voice be a part of building the system. And I think to your point, this is how we kind of do that on the research side of things. It's too often it has been, to your, I think your team, colonial or patriarchal or white supremacy in thinking through how do we do this research and find these solutions. And I think maybe in the Black feminism and in the approaches that are more grounded in, I don't know, like indigenous thought and all those things take us closer to centering community and doing the things that are better maybe for the whole, as opposed to focusing on the colonial, capitalistic, patriarchal factors that we typically do. So, Bryce, what does public health mean to you?
What does public health mean to me? I've had time to prepare some sort of response for this, but I don't think like it does it just service. But I'm not a carceral health researcher, but I do reckon with the ways that like not just abolitionist public health people have been talking about this, but like people outside of that, like Ruth Wilson Gilmore, Catherine McKittrick, and how working towards dismantling systems and policies and other practices that enact these different ways of domination and violence have been part of like state building in public health and actually working towards the root causes of health and harm rather than working toward policing and surveillance and all of these other things that really like work against us, and hopefully to also invite the people that are a part of doing that work to ask questions that are not grounded in reform but more so restorative and reparative solutions. And that looks like very different in so many ways, but I think public health, at least the public health that I hear and show up in and hear how people kind of talk about these futures, like that's sort of like where I've been leaning into.
I love that thought process of grounded in restorative like practices. I think that that's very, very important in many aspects. And that if we all in public health viewed that and actioned on that, I think we'd be in a lot better of a place. But
Exactly.
anyway, so you got your Bachelor's of Science in Public Health from Lindenwood University. Give us that thought process and walk us through going into undergrad.
Yeah. So I will save you all like a long backstory and just give you the Sparks notes. But I grew up as a competitive bowler, and it was sort of the reason why I left the island was to bowl collegiately and kind of just see where this like took me. And I ended up at Lindenwood. I was first at in Utah for my first year and then transferred because the program shut down. And I came to Lindenwood intending to be a nurse to do my prerequisites and transfer to finish a bachelor's of nursing at a school in the city of St. Louis because Lindenwood didn't have a bachelor's program. So I was officially a public health major, but I was trying to be a nurse. And then I obviously had to take a lot of public health prerequisites. And, I kind of like progressed through the program still with the intention of like, helping people, being in the healthcare setting and doing this. And then the way that I was thinking about that looked very different to like what I was being taught in public health and like how those other things, how health really existed outside of like the hospital in a sense. It was part of our conversations, but I think like I developed this like more holistic way of looking at what affects our health. And that was just like kind of scary because all I've known was like health is related to like hospitals and clinics and like this particular like visual setting of like what health means, and then kind of being introduced to all these other things in a very good but overwhelming way. Like it was sort of like a shock. So I think eventually I just was not satisfied with like where I was kind of going with my career in public health or what kind of contribution I wanted to make. So that's sort of like I think I was in my junior year and I officially like declared like a public health major, even though I technically was. I just came off the pre-nursing track and decided to like go full in with that. And that's sort of like how I fell into it. It was not as clean and linear as I describe it right now, but it definitely takes those decisions have taken time to like move forward and take steps back and then be confused and all that stuff. So that's sort of like how I fell into this.
Firstly, Hawaii to Utah. That's crazy, bro. That's that would give you a culture shock.
It was crazy. Yeah. I remember like my mom and dad were able to come help me move in, and like I think we were all like speechless. Not speechless in like a bad way, but more so like, oh wow, it was like very different. Like getting off the plane and like experiencing Utah for the first time. It was different, but yeah, it was a good experience.
I could only imagine what that was like. Utah is a state that I've yet to go to. Definitely look forward to going to sometime soon, but I would imagine that that is a big culture shock uh, in so many ways. But I'm thank you for sharing your journey of like going in, thinking about like nursing, and then the shock of it. And I think this is something we don't talk about enough in public health, is how talking about or learning about health as a broader social context, and then the inequities and disparities that exist in that, how that is just like wow. Because for me as well, that was the same thing for me, because I was on the path to becoming planning to go to medical school, and I got into my master's of public health program, and that was the first time I ever heard about like health disparities, and ever had the thought process of, if I help this patient right now, they might have insurance to go get help somewhere else, and I'm not really dealing with that issue. And there were a lot of thoughts that just came from like that line of thinking of the social determinants really like driving our health. And to your point, it is scary to consider that there are these massive systems around us, that are driving our health and influence our life in such major ways. But I think on the other side of things, it gives you like hope. Is like, oh, this is kind of cool that I could work in this field to kind of enact change and work to prevent and promote health in this new way. So thank you for sharing that. While you were in your undergrad, you were a undergrad racial equity research assistant. Tell us about that position, and maybe any other positions you had.
Yeah, I think that was like one of my biggest, like, I guess more memorable, like, work related experiences. It was my first research position ever. Like, I think anytime before that, research was pretty much in like a bench lab for class. And I was not present for those courses. But I think for this, I just like loved like my undergraduate like mentorship that I've received. Like I always tell them whenever we all like have the time to meet up and talk. But I think like my advisor at the time, Amy Eslin, I'm gonna just plug her in. Like she was working on a needs assessment for like a suburban elementary school in the area, and it was something that was ongoing. So I kind of like came into it like while it's been in progress. And she just needed help with like seeing this through, and I didn't know what I was doing, and she was just so patient with me because I think this was like kind of like the first time I'm applying public health outside of the classroom in that's the best I can explain it right now. I didn't have like any internships before that. I think the semester after I started that, I started working at the health department, but that was kind of like my first like, okay, this is how I'm gonna apply like what I've been learning and all that stuff. And it was really cool. I got to learn how to ask questions, go through like sort of like this recollection of like what I learned in like science class of like scientific method. Not really as like cut and paste, but it was like, oh, like okay, I've heard of this. I've learned how to do this before, but just like I didn't know that this could exist outside of like the wet lab. So
Mm-hmm.
that was like just a good experience with a lot of aha moments, and it gave me the fuel to like be curious in a way that I always got in public health, but not necessarily like in all the other classes that I have taken. So that's sort of like my launching point of like, oh, like people do this for a living. And that sort of like organically led me into like thinking about my master's in epi and thinking about research opportunities like beyond Lindenwood, beyond this like last year of my undergrad. So yeah, I'm so grateful for that experience.
So you got your master's of public health in epidemiology at St. Louis University. But before we get there and the thought process there, were there any undergrad takeaways you wanted to share?
I have so many takeaways, but we don't have the time for that. So I guess I would say like if you're in the space, like if whoever's listening is in the space of like coursework or you're still kind of going through that, but this applies everywhere. essentially. But I would branch out like outside of like those public health classes. I think that's something that I wish I would have been more kind of open to, or just like willing to try at least, because I feel like a lot of, while public health has been so helpful in thinking about health in a more complex way, I do think like as somebody who has taken courses outside of public health, it's also helped shape the way I think about showing up in the work too. So that's something that I would just encourage like folks to just be open to not get trapped in like the labels of what classes are, and the nitty gritty, but more so just like, oh, being open to like thinking about how people are having different conversations, but are very applicable, very relational to like how like I'm currently showing up in the conversation. So yeah.
There's so much to gain from just additional learning outside of public health, and you can bring
Mhm.
that to public health. So I agree with that. And I think it's important to expand ourselves into things that aren't necessarily related to public health, to reap the benefits of that as well. Because anyway, I won't get into that. Anyway, let's get into your master's of public health. So you're sharing that the research really informed you and like opened your eyes to like this kind of research could happen, this type of research. And from there, I guess you thought more about a master's program. You decided to pursue a master's of public health in epidemiology. Walk us through that thought process.
Yeah. So I think doing the public health degree at Lindenwood helped me at least know like what public health might be. I still didn't know at the time, but it gave me enough like knowledge to be like, okay, this is what I could expect like going into the field. But I just don't think like I had the capacity to like dive into the things that I wanted to at the undergraduate level. And I thought like the master's program would supplement those things I wasn't able to do. And serendipitously, like doing the research with in my last year of the undergrad program, also like gave me like this opportunity to like figure out like what that might look like. Like even though I had like such a good experience in my first role, like I really wanted to just kind of like dive into it, and just see like how research has been done, how other public health people do research in a sense. So kind of like really like a lay of the land. And I particularly did a lot of like spatial epi work because, not another backstory, but it's related to the plot. My friend, my really good friend, she got like a degree in GIS, so geographic information systems. And whenever we would hang out, we always talk about like what we're doing, what we're learning. And we would also we would be doing different things, but we would have like a lot of overlaps regarding like things that are location related. And she convinced me to take a GIS class in my last semester of undergrad, and I loved it immediately. And I like wouldn't shut up about it. And it was sort of like that learning of what that is and how public health people have been doing that for a while made me be like, oh wow, like you can marry disciplines together. Like there's a concept called interdisciplinary public health work. So yeah, the gates were opened, and those were the kind of like the thoughts that I was thinking about going into like some of the research that I wanted to do. So that's what kind of like led me to like the MPH in general, not for just like the professional training, but I think like also like what I wanted to experience like as like someone who's still starting off in research. Those were sort of like my two like justifications of like why I did the MPH.
And while you were doing your MPH, you had a few different positions. I'll list a couple of them out and then you can talk about them. And I think going in line with that GIS trend, you were a GIS analyst at Lincoln County Health Department, a Taylor Geospatial Institute research assistant. And then for St. Louis University, you were a grad research assistant, teaching assistant, and implementation science research assistant. So walk us through those positions.
Yeah. I don't know how I occupied all those positions at mostly the same time, but uh I think, well, I think the GIS position the GIS position at the county fell into me because like this was like right peak of COVID, like the summer of 2020, and someone that I knew like that worked at the department like told me about the position and told me to apply because of my interest. And even though I had like literally only a semester's worth of like GIS experience, like I applied, ended up getting it. It was a really good way of like just figuring out like how am I applying this in practice outside of the coursework, but also like it gave me like a good idea of like how to navigate a pandemic in the health department. So it was just like a lot of like different experiences that really opened my eyes as like I'm thinking about like what I want to do after grad school. The research assistant positions like really came in because I knew that like mentorship was so valuable. And at the time I thought I was mature enough to know that like not everybody's going to give me the same thing. Like I'm going to need mentorship in different ways of doing the work. So that's sort of like how I stepped into like different labs and had different feet in like different projects. And that gave me like a feasible sense of like how like what type of work I wanted to do after. How does even like running a lab kind of function too? I think it gave me that like insight as well. And just kind of like noticing and taking my own ethnographic notes, like I was like, oh wow, like this is actually kind of fun, like to ask research questions with people who are also interested in asking questions, doing methods that I was still new to, but was really kind of drawn to because they weren't like how other people have been applying research related to like space and health. And it really taught me what it meant to like do interdisciplinary work, kind of drawing from like other fields and how they're doing it, other researchers and how they're doing it. So it was really like a good way of figuring out, at least to the best of my abilities, to like what it means to do public health research. Like I think that's just going to look so different for everybody, but I think because I did all of those things, it really helped me be better familiar of like what that means. One way of doing public health research is being a professor. And when those thoughts came to my mind, I was like, okay, like being a professor is research, but it's also the mentorship and the teaching component. So that's sort of like why I like was intentional about like becoming a teaching assistant, to like learn what it means to also exist in that space of like academia in itself. And I think all of those just resonated with me in different ways. And I kind of took it upon myself to consider PhD programs. And we can get into that too eventually.
Yeah, and I think it's important just to share that like you got interested in like the research in undergrad, and like now you're in your master's program. You took the opportunity to apply for a position when you only had a semester's worth of experience in GIS, got the position and just brought it out and just expanded and learned all that you could and took up all these positions, which I think is what's important to do, to really figure out where you want to go. And I think to your point earlier, it's like you learn how the interdisciplinary part of public health is so important and how those things come together. While you were in undergrad as well, you are the founder and director of Reach. Can you tell us more about that?
Yeah. So just an FYI, Reach has gone under multiple iterations of branding and programming, but essentially Reach is for research and education advancing community health equity. And it was essentially sort of like, because, well, this happened kind of in 2021, I think 2021. And like, I don't know about you, I think maybe you'll resonate with this too, Amari, but like I've just seen like a big tick in like social media presence of like people in public health, like people creating their pages, following their own journey, like educating in their own way and like connecting through that. And at the time, like there were only like a handful of people doing that. You for sure, and other people. I'm not gonna plug my girl Satara, Donuts and Data. And just like, like just seeing all of that made me like helped me kind of connect with people outside of the university, but just like, people who are still figuring out how to navigate through these things. And I thought having a space that brought people together in that way would be helpful, and building that community, a community that like I once, like at the time of like going through some of these things, would have been like very useful. And I think now more than ever, like community is so important into sustaining our day to day. So that's sort of like, yeah, that became just like this. I don't think it will never stop becoming a space that's going to be undergoing reconstruction and transforming in the ways we use like the platform. But I do think like it's just meant to be like a public facing like resource for people to get what they need, and they can leave if they want to, but like we'll be here to like be of service in whatever way we can. So that's pretty much like what it's been so far.
Yeah, well, shout out to Sasara. I was actually talking to her earlier this week. I mean,
I love that.
yeah. And I think that is important to just create that space, because too often I feel like we do get siloed or just to ourselves, and there's so much to gain from being in community and having conversations, whether professional or casual. So that's awesome. So before we get on to your PhD, were there any takeaways from your master's program that you wanted to share?
I have a lot. Well, I say that all the time, but and I may repurpose this for future takeaways, but I would say like really be thoughtful of like your mentorship. Like I think like mentors are so much more than just being like, you know, like professional like support who are going to help you with this like one particular thing and kind of like move on. I think like just finding good people to like trust in, but also like people who will bring out the better version of yourself, of who you're trying to be, is super important. And I think like my experience in my master's really reflected like this sort of like thinking in a sense, and it really shapes like you beyond the program. So I think mentorship is so important, and I'm sure like I'm not the only one that's gonna be here telling folks this, especially in public health. So yeah, mentorship is very important.
Yeah, an intentional mentorship at that.
Mm-hmm.
So you're a PhD student in the Department of Social and Behavioral Sciences at Yale School of Public Health. What was the thought process for you to continue on after your master's degree and pursue a PhD?
Yeah. So kind of just like summarizing a little bit what I touched on, like I really resonated with the idea of moving up the ladder in academia, um, to do the research, but I also loved like the teaching component and the mentorship component, and um, just having good role models that showed like this is not that bad. So and I feel like a lot of the what kind of like pushed me to do it was sort of like having questions that I've developed on my own based off of like a lot of the things that I did as a master's student, as an undergraduate student, to pursue and kind of train in a way that would make me independent to, excuse me, to pursue those questions and learn these different methods and be surrounded by people who are also as like interested and invested in like these things. And yeah, I applied in 2022. I still didn't know what I was doing. Like I didn't know how to navigate public health PhD program applications. They were different from how I approached the master's applications. And got into Yale. It was the only one that I got into, but it was like I just had a really good experience like during the entire application process, like talking to students and having really good connections like during the interview process. Yeah, that has been very consistent going into or being in the third year right now.
What kind of things did you have to change in your process for the master's versus PhD?
Yeah. I wouldn't say there were like too different, but it was distinctly different because this was more so on like the research part of it instead of just like me and my story into public health, which isn't always the case, but I just found it like that was like just a distinct difference for PhD applications. So it really made me be intentional and much more thoughtful of like what I actually wanted to study and what I actually wanted to do post PhD, because I am very proud of past Bryce because he was intentional about like remembering that the PhD is like supposed to get you to like where you want to go. It's not sort of like this end goal. So I think like going in with that mindset, like I am gonna be fine either way, even though it was such an emotional journey to get through applications. But I think like remembering that the PhD program was only like one way of like doing what I wanted to do. So just kind of coming to terms with that. And yeah, so really just like this, the heavy on the research component of the application is like pretty much the key. And like I'm sure other folks, other PhD students would vouch similar sentiments, but that's just like the biggest distinction from my end. Yeah.
No, that makes a lot of sense because that's literally what you're gonna be dedicating your time for the next 4+ years. So it is, and I think like in that process of writing that, you really are reflecting and thinking on, okay, is this, or like what do I really want to do for the next couple of years? What really do I want to like become this expert in? So that makes sense, and appreciate you sharing that. So you're in your program now. I'm not sure if these current positions that you have, but at the Yale School of Public Health, you're a graduate research assistant, a T32 pre-doctoral research fellow, a graduate teaching fellow, and you're also a research mentor at the Lumiere Education. So tell us about those positions.
Yeah. So part of like me being here is working with faculty mentor. So I'm a research assistant for them on some of their projects. I'm also in like a training program funded by the NIH, the T32. So it's basically like I get together with other fellows and every week, and we kind of like engage in like different learning activities. A lot of it is like grant writing, because that's a big part of like the profession, but also just like other things that are not so obvious regarding like the curriculum of like PhD training and postdoc training. So that's been like a very good support space, a community that meets every week. I'm actually not teaching this semester, but leading up to this semester, I was just like a teaching fellow for some classes, and it's essentially similar to my experience as a master's student doing the teaching stuff, and it was just a really good way to like supplement my pedagogy and like learning what it means to like facilitate a class, how to design one from scratch, like all of the nitty gritty of like what goes into like leading that. So that's been a really good experience so far, and I hope I get to pick that up once I finish this semester. And yeah, and the Lumiere education job, I do it sort of like as a consultant gig. I just it's essentially me helping like high school students kind of lead their own research projects. Most of the time it's like me helping them going through the fundamental motions of like research, like what is a question, like what are the objectives, like all of those things. And it's really like cool to have that time, that valuable time of where they are. Not one, because it's like so impressive that they're like seeking out these opportunities, but I have other things to say on that for another conversation. But I do think like it's taught me like how to just like show up as a better mentor for people who are just entering this type of work at different phases of their life. So yeah, that's been like a really good experience too, and I enjoy it.
Yeah, that's important. Being able to speak to people at all levels, is very important. For the T32, is that something with the NIH? Is that something you applied for? Or is that something you just naturally get as a PhD student?
Yes and no. So some PhD programs like have a separate application process for those grants, because the T32 actually funds like a lot of your training, like the
Right.
stipend, the tuition, the fees, and all that stuff. And that may come often as like a separate application to the PhD applications that you have to apply for, or you don't go through like the standard application process, but are just kind of interviewed for it by virtue through the PhD applications.
Mm.
If you make it, if you get an interview, so it kind of varies, I guess. But yeah, I hope that nuance
Yeah.
description helps.
That's very helpful, especially for someone like me that's very ignorant to these kind of things. So I appreciate you
Mm.
sharing that. And then on the teaching side, so you said that you wanted to get the PhD because you enjoyed the teaching. You've done some teaching while you were in your master's program, now in your PhD program, not this semester. But maybe what are some of the biggest realizations, takeaways? I don't know. How what would you tell yourself starting back over teaching now?
Yeah, I would say like I knew the classrooms were an important space for students, but like moving up the ladder, one being a student, but also two like being on the other end of like facilitating a class in some way, like it made me realize like how much like work we need to do to like make those classes special. And I think this is gonna be me on my tangent of like it's a larger institutional thing of the academy, but like because classes aren't really a priority for professors to do, it's only a small percentage of like their job. Whereas the research part is like most of like what they need to do to like sustain that job. And I think like it's just like a lot. I'm realizing kind of like the politics of like how to navigate that. It's interesting, and it makes me more it makes me just like more intentional about like what kind of class I want to cultivate, like because I would love to I'd love doing the teaching of it, love like being in constant like growth through my pedagogy. And I wish, I guess, speaking to my past self of like getting started, I think just like reckoning with like the expectations of everybody's gonna just show up and try their best, and most of the time like that's okay, but I think like it requires like more, it requires a little going more beyond than kind of what's expected. And I don't know if that came out right, but I just think I wasn't prepared for what it takes to like actually cultivate like a meaningful class. When I first started teaching, I just thought, oh, like you show up, you teach the material, you help students here and there, you grade and you leave. But I think like there's just so much more like required of that I wish I was introduced to. And I think that just comes from like continually doing it and then realizing all of that as you move forward. So yeah, not a clear message, but something that I've been in reflection of, like still.
Yeah, there's more to it than it looks like many times, and many times that's how things are. So I
Mhm.
appreciate that reflection. Um, and you alluded to it earlier. You have a platform, the Epic Epidemiologist. I'm guessing you started that in 2021. But tell us about the journey of starting that platform, as well as what that's meant for you as a public health professional, PhD student, etc. Right.
Yeah. I actually started this like literally the first month of my MPH. So I think September 2020.
Okay.
And like I think I just innocently was like, oh, let me just start this public health page because like I'm doing a lot of public health stuff now, and like it would be cool to
Love it.
just share that like outside of like the academy, outside of like just peer review publications or conferences, just like into like a more public facing like space. And I think that's still the case, but I think over the years I've, like many things in my life, have evolved in turns that I didn't think I was gonna take. And yeah, it's just, I think right now, I think I'm just like using it as a space to like play my part in like collective liberation. And uh and how like social media has become such like a very like, it's always, I think it's always been, but I think like in the past like decade or so, like I think it's been central to like how we share knowledge, but I think also like an underrated mechanism that activates people, like activates like a call to action, to like to do stuff, to be a part of like be a part of something in a
Mm-hmm.
sense. And I don't think I think I'm still learning how to articulate like that, and like my why I have the platform still, or like the page, small but mighty community. But I think like it's just been like under constant like change and reconstruction. So I can't say like I have like a slogan or a brand of like how I want to use it. Not as eloquent as others, but I do think I still use it to like stay connected to people, and build new connections. I think it's like really been like a very convenient way of like reaching people in ways that I wouldn't be able to like if I didn't have like social media. So that's something that I'm constant in appreciation for.
Yeah, absolutely. Social media definitely has some benefits to it, especially in building a platform. I love the idea of using platform for like collective liberation about talking about issues. And to your point, it just allows us, it like breaks down a lot of borders and barriers to communicate and have conversations with people. And I've met so many amazing people through our Instagram specifically, but on the internet. So shout out to social media for the good that it does do as well.
Absolutely.
And in line with the interdisciplinary thoughts and work and conversations that we've been having, you have gotten or are getting a Master's of Arts in History of Science and Medicine. So tell us about the thought process and walk us through why you also wanted to get this degree.
Yeah, I appreciate that. So I'm finishing that up this semester. So after maybe January, December or January, that will be conferred. So that's exciting. But I think my thought process was similar to like a lot of the sentiments that I shared, like leading up to the PhD program. Like I think like I was at a place where I was learning stuff, but I would think I was like learning stuff in a way that wasn't really challenging me to think about things differently. And I took like I think one semester, I think last fall, like a year from now, I took like a couple of classes outside of the School of Public Health, like in the School of the Environment and the history program and sociology. And it was like really like helpful to, although they weren't related to like HIV directly, or like maybe like the traditional talking points of public health, like we were essentially critiquing things very similarly, um that was sort of like, oh, like wow, like people are having conversations that I wish like I would be more exposed to like in public health. Not to like say one was better than the other, but I do think like that helped me like just sit with like, oh, like what if I formally like equip this part of my PhD training? And I think like after conversations with people and like strategically building out like a roadmap of like what courses would supplement like this training, because it's not required. So it was just something that I had to also come to terms with, like this is going to be extra, and I just had to like convince myself that it was like extra enough where it was like beneficial for like a long-term investment. So um yeah, that's kind of like what led me here. And it's really not just like research wise and its benefits, but I think I just met like really cool people like outside of the School of Public Health too. Like I don't think I would have probably ran into these folks like if I didn't like force myself to like be in these spaces. And I think that's like something that like we often hear. Like I don't know if you hear this and like people who try to do interdisciplinary work, but they're like, oh yeah, we need to lean in like to other disciplines, or we need to talk to people more, but like we're not doing the labor or making the time to talk to these people. So I think like this was like in a weird way, like, oh, like I'm gonna force myself to like show up constantly to like be in conversation with people, and let's see where this kind of like leads all of us. So I think like in that way it helps me like it helped me like give me the push into like doing the thing, and not to say like doing coursework is like the only way of like working toward interdisciplinary scholarship, but it was just like because I'm still in that part of my training of like doing coursework, it just like made sense to officially integrate it into the curriculum for me.
Yeah, that makes sense. And shout out to you for saying, you know, I want to be more challenged in this. I'm gonna get a master's and get like a structured learning curriculum around my learning of this. But to your point, I think it really does push you outside of maybe that typical conversation bubble that you're in, and maybe you get pushback from perspectives and thoughts and new perspectives that kind of help you shape how you show up as a public health professional and or do the work that you do. And I'd imagine that you're also helping them think about public health more as they're developing in their scholarly work as well. So before we move on to the Furious Five, where would you like to see yourself in the future?
Ooh, all right. Hard hitting questions. I I think I think right now I'm still working toward the professor job like on the tenure track. But I am those plans are also coexisting with my feelings of like being open to the ambiguity of where this work can take me. Like I think one way or not, like I want to be in a position where I can do this scholarship, but also like have open space to like being community and engage in community as equal like knowledge producers. And I don't know like what type of title that might entail or um job that looks like that, but I want to have I envision having both. um and yeah, I mean, and then I guess like geographically I'd love to go back home to do this work at some point. This is kind of like where my dissertation is kind of taking me right now, so hopefully that leads to a lot of permanent like pillars and systems that will let me come back permanently after the PhD. So that's kind of like where I'm at right now. But the world's on fire, so who knows what might happen. Yeah.
Yeah. Just have to have an aim, you know.
Mhm.
You'll figure it out. Um, Moving on to the Furious Five, the 5 questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
I'm gonna cheat and say something that I've said before, but if you're at a stage of coursework, for students, like I would recommend venturing outside of like the traditional curriculum into whatever way that looks like taking advantage of like electives that could be supplemented outside of like the department or the School of Public Health, and really being mindful and just like giving yourself the time to like talk through like with mentors, with other classmates or colleagues of like what what types of training I can supplement my public health training like outside of this space. So and I think I've learned just as much of like of what public health means like outside of public health courses in an odd way, but that's something that I would just like invite people to just like consider.
And if you're talking to someone wanting to get into your position as a PhD student, what advice would you give them?
Yeah, I'm gonna say something that I've already said, and hopefully expand on it with a different flavor. But like, find good mentors. Like, I can't emphasize that enough. And I think like I define a mentor, or I think about mentors not just as like professors, but like some of my colleagues and my friends I consider mentors. Like, I go to them for like other things that I wouldn't be able to go to for a faculty or vice versa. And I think again, like these are not just people who are going to be there for you professionally, but I think like there's good people who believe in you and like really like have the patience and like uh and willingness to like invest in like your growth as like an early career scholar or researcher, and just to be like a better version of yourself too. Like, I think like aside from the professional and research stuff, like I think I've just like also had just a lot of good people to lean on, that taught me a lot about myself too, and like who I want to be like as just like a person doing this work, not even just like a researcher or like a professor or somebody with that sort of hat on, but just more like how do I like want to show up. And that's just like been so like grounding to do, because we do a lot of like community work, we do like people to people work, and I think like that is also something that um gets lost sometimes. So, but your people will keep you grounded.
Number 3, what's something you're working on improving in your life right now?
My whole life is a work in progress, but to be serious, I think I've been more intentional about being slow and embracing and tolerating the ambiguity. I feel like we could have a whole podcast series about the academy, but that's not the case right now. So, um, I think just like like being in this field has like taught me, actually ingrained in me, that like fast science is like good. And while I do think there is value in like being able to get this out quickly for people to like make quicker decisions, like I think the slowness of it has also been lost, and not just like the slowness of like doing the work, but I think just like slowness as like people being in this environment. Like, I maybe like I don't want to work on the weekend, maybe I want to do something else with my life, because uh my my identity isn't
Mm-hmm.
fully attached to just being a researcher and uh a scholar or something like that. Like, I think like there is like slowness in like that sense, but also like tolerating the ambiguity too. So like putting back my research hat on, like I think like I knew like going into research, like there's just like a lot of unknown that you're just going to encounter regardless, and that can be overwhelming. And I think I've learned how to like negotiate like when to and when not to like tolerate, I guess. But I think I'm like being better with like just being okay with like not knowing, and like trusting that like myself and the team that I work on and the communities that I work with, like we will get through it in a sense. And uh yeah, just stuff, just like very small stuff like that has been like that I've been making small actions towards, and I've seen like very direct benefits from uh those like habits.
Appreciate that. Number 4, professionally, do you recommend anything?
Uh so I just finished watching the TV series Pose, and it's basically, I think 3 seasons, and it's just a bunch of various events that occurred in the 1980s, from like ball culture to the HIV epidemic to LGBTQ civil rights and all that stuff in New York. And I think like it's such okay, maybe because like I'm an HIV researcher and like queer and trans health like advocate and stuff like that, that just naturally I got drawn to. But I do think like it was such a good binge. I'm resisting myself to not rewatch it like right now. Like let's let those feelings sit and then I can return to it. But yeah, I think it's a really good show.
It's interesting you mentioned that because someone that I interviewed for this podcast mentioned that a couple of weeks ago as well. So definitely have to put it higher up on the list as well. What platform is it on?
I think it's on Hulu.
Okay.
Yeah, I'm not sure if it's on anywhere else, but Hulu, it's on Hulu for sure.
Okay, awesome. Well, I'll put that in the show notes for anyone that is interested. And then number 5, last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
I would say worry less. Like I feel like growing up, I've been kind of ingrained to like plan ahead and overcompensate because of like uncertainty is scary. And I think like I understood where like that habit came from, because not everybody can afford the uncertainty that comes from like a lot of these things. So but it's like everything, it's like a balance. And I think I wish I just worried less, because a lot of the things that I've worried about before like really didn't matter as much as I thought it would. And it really just like not, it really kidnapped me from like living in the moment and enjoying the present. And as cheesy as that sounds, I think like we don't do that. So and I guess like that goes into like your previous question of like what I'm trying to work on in my life right now, and it's still like not worrying and tolerating like the ambiguity. So I wish someone like comforted me like that things will optimistically like work out more than you think. So yeah.
Yep, yep. Worrying can steal our joy sometimes. So appreciate you ending on that note. Bryce, thank you so much for coming on and sharing your story and insights. Look forward to having you back on, and look forward to staying connected with you.
Yeah, thanks so much for having me.
Truly, truly is my pleasure. Housekeeping items, everyone. Thank you all so much for listening or watching this. Be sure to hit that subscribe button if you have not yet. Leave a like if you're watching this on YouTube. Leave a 5-star review and share this with a friend. See you all next week, everyone. Peace.